there are lots of disorders that we have very little that we can do from a pharmaceutical perspective in particular. And I'm thinking here of neuropathic pain, where we just have so little, and yet it's the most tricky type of pain, I think, to deal with. And then we've got this group of pains called nociplastic pains, and migraines and fibromyalgia and irritable bowel and interstitial cystitis. They all fall into this group, and they're a bunch of disorders where you can scan the body as much as you like. You'll not find something that you can structurally address. It's about the way that the nervous system is functioning, and that's dear to my heart because I live with fibromyalgia. And it's not a figment of my imagination, and I'm not making it up, and I know a lot about pain, so I can't be educated out of my pain. But actually, it's a reality that there are very few ways of treating it to reduce the pain. So everything that somebody with pain, and this is whether it's a acute pain, it's a neuropathic pain, or a nociplastic pain, people have to do the daily living. And that's why I think thinking broader than it's a disease helps us to think, here's a person who's going to leave us after we have our half hour with them or an hour with them. And they're going to go away, and they're going to have to do a whole lot of stuff for themselves. And unless we think about how the things we advise them to do fit into the context of their lives, probably they won't do it. So we have to think carefully as health professionals about when, tailoring our expectations and the things that we ask people to do so they can get on and live a life without just making their pain management their life.
Yes, exactly. Yeah, well, and I'm sure something like, disability identity or disease identity really plays a role in that too. Like, we don't want to be reinforcing this idea of you're a patient, right? Like, you've got things to do after you leave me.
Absolutely, and I think that's something that we can forget. So, within prescribing exercise, for example, to somebody who's had an accident and they've never exercised in their life before, they develop this back pain, and suddenly they've got to do exercise. And I think sometimes we can forget that we do movement in lots of different ways as humans. So exercise and go to the gym and do lifting things and jogging is one form. But so is gardening, so is dancing, so is playing with your kid on the ground and throwing a soccer ball. There's so many different ways that we can do that movement part of what we know helps people with pain. So I'm trying to liberate, the idea of what we do for people with persistent pain from the inside a little box or a gym studio or somebody's clinic and out into the wilds of the real world.